This is a project of the Latino Coalition for Community Leadership. It is funded by the Colorado Department of Public Health and Environment. Today, we're welcoming with you to hear a little bit about the Latino Coalition. We're going to give you a brief overview about the proposal, the startup, how to answer some of those questions, and also review some of the highlights on the special dates to be aware of, and also answer any questions folks may have. So first, I want to get started off with talking about the Latino Coalition for Community Leadership. We exist to bring equity to the inequity of funding for minorities in the community sector, and also who are maybe faith-based organizations. And basically what we found is 20 years ago, the founder of our organization, Richard Ramos, was really just aware that money was not getting into the hands of people who were providing services in community, and really wanted to figure out why that was happening. And so the Latino Coalition serves as an intermediary organization where we are trying to make sure we get resources into under-resourced communities. And the way that we go about doing this is we find organizations, usually grassroots or faith-based organizations, that are working with low-income youth and families. And so then we fund them. So we're always looking to get money to give money out. And then the other part of our 4Fs is we really work closely with community organizations to ensure that they have technical assistance, the database that they need to collect data about what they're doing, the infrastructure, financial, to be able to receive money and demonstrate using money in a judicious manner. We also do training and capacity building. And then the last part of what we do is called feature. And so we're really looking at this conversation of how do we feature the work of the community organizations that we're working with, and kind of in that conversation about nothing about us without us. And so really, really trying to ensure that the work of the community organizations is elevated. And that's kind of what we've been up to as the Latino Coalition. I just want to tell everybody a little bit about how we got here in this particular work. In 2017 and 2018, there was a report called Victim Speaks, and it really spoke to underserved people who have been victims of crime. And what the report identified is that people of color, men and young adults, were the most likely to be experienced being a victim of crime, but least likely to get support. And then a bill was passed called HB 1409 in 2018 and 19, where we really kind of got this idea that we could have resources, but funded through the Colorado Department of Public Health and Environment, and really looking at violence as a public health issue. Most resources come through the judicial system when we're taking with folks who have been victims of crime. And so this was an opportunity to do something different. And then in 2019, CDBHE awarded the Latino Coalition a contract to be what's called the intermediary. So we play the role between the community organizations and the state organization. Our first year of our grant was $880,000. And we awarded that to 5 different community partners. And we are now in year 5 of a 5-year project. So that means we went through something called a sunset review. I have this thought that if everybody went through a sunset review, we'd have better results. But we were able to really demonstrate the gift of having a community-based response. And we were able to get past the sunset review. The grant was renewed for another 5 years. So it will be done in 2028. And they gave us an additional $4 million so that we could give out some more resources and get new community partners. In addition to that, while we were going through sunset, the Colorado Department of Public Safety also awarded us $2.5 million, and we're doing a project called Community Voices, and it also is geared towards serving people of color who've been victims of crime. And I just want to share a video that gives you an overview of the project.
The impacts of violence
Can everybody hear?
like a drop, and they ripple
Thumbs up?
outward. And it doesn't just impact the person who's been
Okay,
directly
thank you.
victimized, but it impacts everybody who has immediate contact with them.
The narrative has traditionally been that when it comes to victims of crime and victims of violence, our funding dollars and our intervention focus has been on one type of demographic at the expense of another. We don't typically talk about people of color or men and male youth in particular as being victims. And we have a false belief that within the criminal justice system, one is either an offender or a victim, when in actuality, the vast majority of perpetrators of violence were victims themselves long before they ever hurt anyone else. And we know that hurt people, but also healed people, heal people. So how can we seize control of the narrative and provide a counter-narrative toward the end of healing and violence and victimization prevention?
The motivation behind the origin of this CCVS program was really looking at what survivors need in the state of Colorado. You know, our research, what it illustrated or demonstrated was there is a significant gap in services. And so the motivation behind it was to really look at how do we provide community-based victim services for survivors who are dealing with short-term and long-term trauma from being a victim. One of the most important parts to this particular legislation, House Bill 1409, was that the funding is placed in a state agency, right, that then re-administers through a third party intermediary the funding to community. Well, that state agency is the Colorado Department of Public Health and Environment, which is profound because historically funding usually goes to the criminal justice agencies. But we believe that we're really dealing with public health issues, especially as it relates to trauma, PTSD, that we found that a lot of survivors are dealing with. And it's really a health related issue and not a criminal issue at that point in time, especially if it's long term.
It's funding that in my 18 years of providing service, I have not seen. I believe it's a new movement within the state of Colorado, and it's truly what I believe that Colorado needs.
With the CCVS program, we have kind of two different portions of it. One really speaks to direct service. So we have community partners who are really entrenched within those communities, all led by people of color that are really part of the community that they're serving. They're not parachuting in. They've been part of that fabric, so they live, shop, work, worship in the same communities that they're serving, and also have lived experience. So that really speaks to being able to connect with the people that they're serving. I think the focus is really on connecting with people who've been traditionally underserved and making sure that they're getting the help and the healing that they need.
Giving the funds to those organizations who've already been doing the work, they just wasn't able to get the financial support to back them. It's been amazing to see how many lives have been changed, how many people are coming.
And then on the side of the supporting interventions, there's a lot of things that we don't know about these particular populations and why they don't access services, or what kind of services would be meaningful to them, or what are the best approaches for certain types of populations. So the supporting intervention grantees get to take a look at those types of questions to help inform what we should be doing on the ground.
The things that were really eye and heart opening for the research team, people needed other people to help them heal. People would talk about how someone in their life was kind enough. They were the opposite of violence enough to help them start to heal.
I think what's really innovative is its ability to reach communities of color. We have seen from the data in the past year that over 90% of historically underserved people have been served by this program, which is very different from data from our other victim service providers at the state level.
The success stories always identify somebody who's had a shift in their life. And they're saying by participating in our project, they are able to make a difference and ask new questions and to be an advocate for how do we get support services in community. So going from the role of being kind of a crime survivor to go into the role of being an advocate and champion for healing.
These people feel empowered, they're feeling reconnected, they're reintegrating more fully, not just in personal relationships, but social relationships, workforce, experiences, just all the way around. These are the things that are promoting like the reduction in the re-victimization.
I would want people who have experienced victimization, whether it was once, twice, 8 times, to know that the CCVS program is their program. It's there for them. It's created by people who have been victimized, and they understand, and it's home.
This is the time, this is the place where these type of investments can transform what's happening in community. And so it's important that we finally approach this holistically, and we finally approach this as something that's of value.
Okay. And just my last little thing that I'd like to share with everybody, we definitely had some accomplishments that I wanted to just highlight over the last 5 years. We definitely worked on, ensuring that more resources were put into this project. Each one of the folks that got funded originally has tripled in size. The organization has tripled in size, and that's been kind of a witness of the growing pains that brings and the beautifulness to be able to serve people in the community deeper. We have cross-project collaboration. Sometimes folks aren't ready to, engage in therapy. And so sometimes they went to do ear acupuncture. I think I've shared the story a couple of times where we were able to have therapy come to the ear acupuncture so people were ready to talk afterwards. So, you just never know what we can do when we work together. We definitely did a lot of training and development about working in communities that are underserved. Some of the folks that we serve are probably some of the hardest to reach folks. And that requires us to really kind of dive deep into expanding, how do we be aware of what's the best way to serve them. We've also done 2 projects on research. One was the one that Cristiana from Voces Unidas talked about, where we researched about, kind of what does healing look like from repeat victimization in particular. We also elevated the work of leadership of color and people with lived experience. So those are some of the accomplishments that we've had in the last several years. So just a little bit of an overview on the Community Crime Victims Services Grant Program. And basically this program is to exist to expand community-based victim support services and interventions aimed at reducing repeat victimization. Like I mentioned earlier, the sunset will be in 2028. We're looking at prioritizing community-based organizations that provide culturally relevant and trauma-informed crime survivor services through a delivery model that is accessible to historically underserved crime victims. And basically, I had shared earlier that I had met with a group of people who did a lot of healing work, and they were like, well, we've been doing this work in community. We need you to fund what we do. And so a lot of ability that we've been showing is how do we look at their indigenous practices? And I call it community informed best practice. And so there might be things that you do in your organization that really serve community. So we can create evidence for that because of the way that you work. The folks that would be eligible for this particular grant program are folks that are a nonprofit organization. We're looking for folks that are in good standing and registered with the Federal Internal Revenue Service and also with the Colorado Secretary of State's office. This project is also open to tribal agencies and programs. All right, so the target population, and this is taken directly from statute, is crime victims and victims of the immediate family. And we're actually looking at underserved populations. And so that also can include indigenous communities, LGBTQIA, BIPOC folks. It could people of color who experience having disabilities, but whoever is underserved. But we're looking at also being able to serve family members. So that could be a spouse, it could be a child, it could be a sibling, a guardian. So it's really important for the collective to heal. And so what we're finding from our programs is once somebody comes in, they start recruiting, they start getting their aunts to come, they could start getting their uncles to come. So it becomes something where families can be served together. And the only thing that we're going to be looking at is we're going to have a screening tool that we're asking all of our community partners to be able to use. And basically what that helps us do is to be able to collect information across the grant program. And so we can talk about the project as one. And so that's like a very simple intake that everybody would be using. Looking at what kinds of services that are eligible, definitely looking at, what does healing look like, advocacy and coordination, prevention and intervention, awareness and engagement. And then there might be other allowable things that you might be interested in. And I'll talk later about if you need to ask us if something is a good idea or something is fundable, there'll be opportunities to do that. We have a case manager system, and collecting data is really vital to telling our stories. And so case management is going to be a mandatory part of this particular project. And basically we use case manager to discover who's eligible, to do the intake, to record services and activities. And also when you are making referrals, there's a way that you can track that in case manager also. So this is a little bit about, what's funding is available. We're looking at being able to do 2 awards. And the funding period, we definitely can't make a contract until we get final say-so from the state. So that's in all parts of our instructions in our grant. And it's just something that we have to adhere to. So once the state gives us the money, we'll be moving forward, but we wanted to start this process. Depending upon the number of people who apply, depending upon who's qualified, we're going to be looking at this type of funding availability. So your funding is going to be for 5 months, and it's going to cover February 1st, 2024 to June 30th, 2024. And basically, we're thinking it's going to cost everybody about $63,000 to operate for 5 months. And then there's $12,000 that could be available if you're interested in startup costs. That could be computers, hiring, the things that you need to start a new project. And then I'm going to also ask everybody to do a 12-month grant application. So basically together, it's 17 months. And that'll go from July 1st, 2024 to June 30th, 2025. And that would be up to $150,000. Given good performance and no major lack of performance or egregious mistakes happening, we're looking at this to be funding available for continuous for 5 years. When looking at like what kind of performance measures we're going to look at, and we're going to be looking at a couple things. One, we're going to look at enrollment rate. So you're going to predict how many folks would I enroll in this project, and then you're going to, compare that to your actual. And so we want our enrollment rate to be 100%. That people come across you, they want to participate, and that's what we do. And this project has been over enrolled since we started. We're also being checked on how do we reach historically underserved populations. And so what we're saying is at least 60% of folks served would meet that particular description. Then we're also going to be looking at access to services. We want to make sure that people are connecting to resources. In the report that I mentioned earlier in 2017-18, there were services that folks were interested in, but were never offered. And so what we're looking at is how do we make sure that the folks that we're targeting get offered services? And so what we're saying, of all the people served, 60% would be accessing services that they need. And then the last performance measure we're responsible for is participation feedback. And all we're basically saying, of all the people that are served, 75% would say, yes, this was of value. I'm going to talk a little bit about budget and money. And so for this particular grant program, unallowable costs are entertainment, alcohol, and abortions. This budget will be evaluated that you propose on reasonableness and how it supports achieving the performance outcomes. Again, I mentioned earlier, these are the 2 fiscal years, and every time I've done it, I didn't change the date of this slide, but that goes to July 30th. This should be July 1st, 2024 to June 30th, 2025. So looking at your budget, we're just going to look for, there's a couple of worksheets. Again, all of this is available on the Latino Coalition's website. We suggest that everybody print your instructions so you can mark them up and highlight them for the important parts. We're also looking that you fill out the budget template with the attachment that we are supplying, and we will not accept other templates. The kinds of things that we're looking for as far as expenses are concerned, we understand that personnel is usually a large expense that people are going to accrue. So we're looking at being able to share, this is the kind of narrative we're looking for in our budget narrative. We're looking for, if you have a position, what you're going to name the position, how do you justify that working in the project, what portion of a full-time equivalency is that person working? 25% on this grant, the number of months you're budgeting, and the total cost will automatically be calculated when you are using this spreadsheet. When you're looking at program expenses, we're looking at the cost of the item, being able to justify how it connects to the project. If there's a rate for a cost, if there's a quantity, how many months are you budgeting, and then what service categories are you going to attribute money to. We also know that staff development is a really important piece of whenever you're building a budget. And so we are asking everyone to ensure that they put in mileage reimbursement would be at 49 cents, and then include at least a couple $1,000 where staff who would be working on this project will be able to attend quarterly meetings. And also training. Another expense for everyone to just, that we have to deal with is sometimes we have folks who have leases. Facility expenses are allowed. We can pay for maintenance, communication, utilities, and just knowing that the CCVS portion of the facility cost. So if you have an office space and say you have 4 office spaces and one of them is going to be used for CCVS, then you would use maybe a square footage on how you cost allocate between programs. Sometimes people cost allocate between the number of people who are working on a project. So that's something we would definitely support you helping to figure that out. You got a question? You good? Okay. I hear someone talking, but all right. Just like I thought shared earlier, in year one, there can be one-time investments up to $12,000. If you need more than $12,000 for a startup, it just has to be justified. Say you're going to do, I don't know, some type of outreach that required tablets. But tablets need maybe ongoing Wi-Fi access. So you can have the tablet serve as a one-time cost, but ongoing maintenance for something that would not be categorized as a one-time cost. And then for administration, you're allowed for a 10% indirect cost. Some folks, if you're a big organization or you've done this, you've negotiated a federally negotiated indirect cost rate, which is called NICRA. And if you have a NICRA, you can let us know at the Latino Coalition and we will work that out with you. So those are the major kinds of things around the budget. But I'm also asking people, are you ready and what to consider? What I'm really looking at is, you know, are you folks ready to learn new things? Is your organization willing to learn new things? A lot of times money comes with strings attached. And are you interested in that? The organizational documentation is not, you know, too extensive. It's your 501c3 and a good standing with the Secretary of State. We want to really make sure you think about, you know, defining what area you want to serve, and how you will serve that target population. Be thinking about your program services, like what am I going to be good at delivering? And also making sure you've done thoughts about your budget. This type of program, you know, we really support collaboration. And so, you know, that takes relationship. It takes, you know, really sincere commitment. And so sometimes those things can be frustrating, and we might have some experiences in the past with collaboration that didn't work, but I just want you to know we hold space for collaboration. And how the Latino Coalition for Community Leadership works with community partners is very closely and intensely. And, you know, are you ready for that? And when I say intensely, that means like we're asking lots of questions. A short way of saying it is like we're all in the business. When you're looking at your program services, you know, just be thinking about, like I said earlier, like location, you know, what kinds of things, if I'm targeting folks from a particular group, do they need? And we don't expect everybody to be everything to everyone. So what kind of connections will you need in community to be able to refer people? So thinking about program services, and if you're ready to take this on, those are the kinds of things we're asking folks to consider. All right, so gut check, right? Are you ready to work with folks who have both been the perpetrator of violence and the victim of violence? Like we talked earlier about that intersectionality. And are you ready looking at what ages and genders are you focusing on? Are you able to talk about how your cultural competency comes through in your work? And also, this is what I said earlier, do you have a team or do you have colleagues that you can refer clients to that need things beyond your ability and what your organization does? I talked earlier already about the kinds of paperwork you'll need. If you are selected, there's some immediate insurance policy stuff that has to be taken care of that would name the state of Colorado and the third-party grant administrator as additional insured. So I know I talked earlier about budget, but just really making sure everyone understands what does it cost to run the project that I'm suggesting. And so really be thinking about this, you know, all the things, the supplies, the staffing, you know, if you're having it location-wise, do you have to rent? So really want everyone to be very thoughtful about that and making sure that there's a an accountant that you spoke to and understanding if there's any implications about, if we take this money, does this like do anything else to our organization? And what's really important is that there's no intent for anyone to lose their identity in taking this money. And so I really want to make sure people think about that. But strings attached, yeah, we are going to ask folks to do reports. There'll be program and fiscal reports. There'll be the expectation that folks meet performance requirements. And, are you really willing to receive technical assistance? And, are you okay with this? And so these are the kinds of things I would like people to think about before they apply. Here's some important information. So the grant was released on November 27th. We're having bidders conference. This is actually the last bidders conference. We've had 2 already. This is what I'm going to make sure that everyone online gets invited to virtual grant office hours. So we're going to have that on December 18th, the 21st, and 28th. You can drop in, you just register and drop in anytime between 12:30 and 2. And you can bring ideas, your budget, questions, do you think this will work? Kind of ideas to us during that time. And then this grant will be due January 8th, 2024 by 5 p.m. Just in general, how this timeline is really going to work. In January, the grant will be due. We'll go through the review process, and then we will let folks know they've been awarded or not awarded, probably the week of January 24th. We will be executing an MOU, and then the month of February, first is when the grant actually starts, but February is like a get ready month and a training month. And we'll have trainings on February 7th, the 21st, and the 28th. And then you're not expected to enroll participants until March 1st, 2024. And again, this grant completes in 2025. And then sometimes, depending upon what's happening with the legislature, there probably isn't a new application that's going to be due. There might be some updates to old applications, but again, if people are performing well and things are going well, then we're going to move forward with continued funding. So I already said this, that the award is notified on January 24th, and disbursement starts for February 1st, and the grant begins no later than March 1st. Just a little bit about what happens in February. Like I talked earlier, it's that community partner internal startup month. The training that we're going to be looking at is going to consist of familiarizing folks with Case Manager, looking at having a data system training, looking at our fiscal management training, and again, low enrollments are expected. There's my other one. We're also going to start direct services in March. And then you will have a program manager who is going to be my colleague, Cynthia Randall, who happens to be traveling right now, but she will be back. And that's why I get to do all this get ready stuff before she returns. But Cynthia Randall will be the program manager for this particular grant program. And she'll work with community organizations on, where are they in their capacity building and helping design what does capacity look like in the future. We have site visits that we do twice a month. We'll do trainings and monitoring of performance, and also like a problem solver with you if there's anything we encounter that we need support with. This really talks to a little bit about the things I was just mentioning earlier about how the Latino Coalition works. It's more of like a coaching model. Monitoring isn't like a separate thing. Monitoring is integrated into kind of how do we look and how our performance. And because we have so much contact with our community partners, we are always working together to solve these. Data is critical. Again, data is used to be able to tell our story. We're looking to make sure that we have partners that are good stewards of public funds. We want to invest in organizations that demonstrate measurable impact. And we really look at this as we have accountability to our participants, our communities, and to each other. All right, so just winding down, be sure to review the RFP guidance. Again, I think that's another document that I would print because it's rich with information. It talks about what types of projects will be funded. It also talks about, the scoring. So that's a really great document to print. The application is actually built into Submittable. And Submittable is where you would put your application. I understand Submittable also has the ability for you to partner and let other people, like if other people are working on the grant or need to fill in a narrative portion. So it allows you to save your work. The other thing that we want to make available to everyone is one-on-one sessions. So not only are you encouraged to go to the group session for office hours, but we also, if you need one-on-one time, our staff is available to do that up until probably about the end of December, like the 28th. All right, and late applications will not be considered. All right, so check your proposal checklist. Ensure when you're writing that you're tying the activities to the performance. Like I said earlier, I encourage everybody to print instructions. Make sure you complete year 1 and year 2 budgets. And there is a cost allocation and startup costs, and make sure you include that in your description. A submittable allows you to save your work. I mentioned that earlier. Remember, when you get started, if you're selected, you'll have a couple of insurance requirements. And then if awarded, applicants are agreeing to use our screening tool. All right, so if you want more information about this, you can go to the Latino Coalition website, latinocoalition.org, and then you go to the RFP tab, and it will give you a drop-down menu of the budget instructions, the template for the budget, the instruction guidelines, and then, like I said, the application is built into Submittable. Again, I wish everyone good luck for thinking about this opportunity. I'll also take questions. I always put this quote on the bottom of this. Opeloncah Pugh is a storyteller, and she's now an ancestor, but she would say that we are the ones we've been waiting for. And so I believe that, if we're going to make a difference in our community's lives, we're the ones to do that. Again, this is my contact information. This is Cynthia's contact information. And I am complete with my presentation.